Hey guys, this is Dr. Christina Hammer here today with Stephanie, our RN, as well as aesthetic nurse here at Vibrancy VIP Med Clinic. Now, one of the things we're going to be talking about is one of our aesthetic services, microneedling. So Stephanie, please tell me a little bit about microneedling.
So microneedling, that is one of our most popular treatments here at Vibrancy VIP Medical Clinic. We basically use a microneedling pin that is going to create micro channels into your skin, and it's going to help basically produce collagen and elastin to make you have a more brighter, more youthful looking appearance.
So who would be a great candidate for this treatment?
Almost anybody who wants to have good looking skin, youthful, people who are trying to treat fine lines and wrinkles, if you have acne scars, stretch marks, hyperpigmentation, those are all great candidates.
Would somebody who's losing hair be a great candidate for microneedling?
Absolutely. We could do microneedling or PRP injections into the scalp, and that will help stimulate hair growth.
Now you mentioned PRP. What is exactly PRP?
So PRP, stands for platelet-rich plasma, and it is derived from your blood. So what I will do here at the clinic is I will draw your blood, spin it in a centrifuge, and then what will come out at the top will be some gold yellow plasma, and I will basically reinsert that back into your skin, and it has growth factors and stem cells that help boost and treat your skin, stimulate collagen and elastin growth.
So I have a quick question, Stephanie. So if I were a patient coming in, how would I talk to you about this?
So I always do consultations first. My consultations are free, and you could either find us on social media. We have Instagram, Twitter, Facebook, YouTube, or you could just call the clinic, set up a free consultation, and I will basically chat with you about the pros and the cons about this treatment.
Is everybody a candidate for this?
Most people are, but there are certain people that wouldn't be a candidate. So if you have some keloid scarring, or if we're doing it for balding, certain people are not a candidate for that.
When it comes to actually having the microneedling done, how long would a patient have to wait before getting that treatment if they had a special event or pictures being taken?
I would recommend at least 2 weeks. I would not do a treatment if you have an event coming up within the next couple of days, because the downtime is about 2 days to a week. You are going to be red, you're going to have some flaking of your skin. The rejuvenation takes some time. Usually you want to do a series of 3 to 5 treatments before you get the maximum results.
Wow, that's amazing. So today we are going to actually demonstrate what microneedling, how that procedure actually goes on me as if I were one of the patients in the clinic, so that you guys can see what microneedling is all about. Alright guys, so we are in the room that we actually do the microneedling. Now before we start the microneedling and we apply the numbing cream to my face, we have to get the blood drawn. So Stephanie is going to be taking my blood and then putting it through a centrifuge to then spin it down. So this is all a process, but it's a great process that's going to give lasting results. How's it going?
Yep, it's going.
Hey guys, we're back. All right, so Stephanie has taken my blood. She is spinning it down right now in the centrifuge to separate those red blood cells from the plasma. Remember, that plasma is going to be used and applied to my face to help tighten that skin, rebuild that collagen, as well as the elastin. Now, before we go and have those procedure actually done on my face, Stephanie is going to be cleaning off my face where I have makeup on my face, as well as the natural bacteria that helps protect my body. All right guys, so right now we're in the part where Stephanie is washing her hands, because anytime we do a procedure, the person doing the procedure will wash their hands to make sure they get all those germs off their body. All right, so we're getting ready for the next part of the procedure, which is having Stephanie clean off the makeup of my face. Hopefully this beauty's still there. Just kidding. All right guys, so Stephanie is cleaning my face. Why? Like I said, she has to remove all that bacteria as well as my makeup that I love to put on a daily basis. And so like for all our patients, before we start any kind of facial procedure, we are going to have Stephanie clean up that face as well as give you a little massage so it kind of feels nice during the middle of the morning or even in the afternoon. So Stephanie right now is going to be getting a towel that's nice and warm that's going to be going on my face, and it's going to feel so nice and relaxing. The type of skin cleanser that Stephanie uses is for sensitive skin. So any type of skin type that comes in, whether it's dry, oily, sensitive skin, we have a type of facial wash for you as well. Okay, so this next part is really exciting for me because nobody wants to feel the pain of needles. And this part is we're putting a topical numbing agent on my skin. So Stephanie, do you do this with all the patients?
Yes, I do this for comfort for most people, but also like you said, we don't want people to feel the needles, so it is good for anybody, even if you don't think this treatment is painful.
Now, what I do like to tell patients is the numbing cream, we want to kind of let it sit for at least 5 minutes so it gives it time to actually absorb into the skin and actually do what it needs to do. Because when we do treatments here, we want you to be comfortable as well as kind of fall asleep sometimes because it can be that comfortable, right, Stephanie?
Absolutely.
So some of the things that we didn't make mention that I think is really important for people to know is that when we do the microneedling, we're going to stay away from the eyebrow actual area. The reason being is because, like myself, when you have microblading done, we don't want to take any of the natural pigmentation away from the eyebrow. So we go around it, not on it.
Yep.
Anybody that knows me and anybody that works in the clinic, we constantly change our gloves to make sure that we don't have any bacteria on our gloves, especially when we're touching the face.
Yep. So I'm going to draw up the PRP now, and we'll get started. So this is the PRP. That's what it looks like. And this is the liquid gold that we were talking about.
Liquid gold.
Yeah. These are red blood cells and white blood cells, and then this is the plasma filled with platelets in here.
Now, Stephanie right now is removing all the numbing cream that's been sitting on my face for at least 5 minutes. And we're taking off so we can get the procedure started. You know, the numbing cream is great. When it's applied, it does feel a little thick and sticky, but the great thing is before she does the procedure, she's gonna remove it with a nice warm towel. So I tell people you really don't feel anything. Sometimes you'll feel that numbness, but it'll go away after a while.
So now this is where I use the alcohol wipes. Like I said, I use a lot.
Now here at Vibrancy, we do have scented alcohol, cherry flavored. Oops, scented, I shall say. And it smells good.
Cherry flavor.
Not flavor, I meant scented.
So this is kind of what you should see. I don't know if you could like zoom in on it, but you could see the needles in there.
And it's not just one needle. There's multiple needles that are going to penetrate my skin.
You see it?
Yep.
Okay. So we're ready to get started. First, I'm just going to apply a little bit of the PRP onto her face.
And I think the great thing about using, your own plasma is that we know you're not going to have allergic reaction because it comes from your body. So your body's going to respond nicely to it.
So this is not, there's no needle here. It's not a syringe. You could see that this is just what I'm taking the PRP and applying it to her face. So we use this. So yeah, technically it is.
And so that way I think, just so people can understand, it just helps so that when you're actually using the microneedle, it helps it glide over the skin nice and smoothly.
Mm-hmm. All right, so here we go. So you might notice her skin start to have some pinpoint bleeding or some redness.
And that's what we're looking for.
And that's okay, yeah. Typically the forehead, the upper lip, and the more bony areas like the nose are the most painful.
But you know, having this done, it's very comfortable, it's relaxing. I can explain being the patient in this scenario, it just feels like a vibration going over different areas of my forehead. And as you can see from my face, I'm not flinching, just smiling. You know, a lot of people like to say, well, you know, can I go back to work? You absolutely can go back to work. And the one thing is the longer you keep that plasma on, wouldn't you say, Stephanie, at least 24 hours to keep it on, or at least overnight?
I say at least overnight, yeah. Your skin is gonna feel tight, but we really wanna keep the plasma in there, the platelet-rich plasma, to help keep doing what its job, keep healing the skin.
That collagen turnover. I think it's great. And you know, after this, I'm sure you can see this during the process as well as even after, you're going to see a nice, vibrant, radiant look on my face, as well as how it will tighten some of the areas because of age, as well as gravity has pulled down, and it will tighten some of those areas up.
Yep.
Up, up, up. Now, one of the most important things that I know we didn't make mention earlier is staying hydrated. Especially if you're going to have blood being taken, the most important thing is stay hydrated by drinking lots of water to help make sure that those veins are nice and palpable, so when we get your actual plasma and blood, we have more of it to use. And for patients who have a lot more plasma, they're going to have greater results. Wouldn't you say, Stephanie?
Yep. The more hydrated you are, the more healthier you are in your skin and in your body, the better this treatment is going to be overall for you.
And you know, when the plasma is applied to the face, it feels nice and soft. I'm not feeling any pain. I don't feel any whatsoever. A needle, like I said, you just feel the vibration. It's very comfortable. Now, like I was saying, because no matter where you live, every climate is different. But here in the Southwest, it's very dry. There's no humidity, so staying hydrated is key. But because we are at a higher elevation, we do get a lot of skin damage. The microneedling is great to help rejuvenate that skin and help repair the damage that not only time, but being in the sun has caused. So with the microneedling, we do have different settings, and Stephanie can adjust for the different thickness of the skin of the face as well as different body parts, because the thickness varies, correct, Stephanie?
Yep, it does.
So because the cheeks are a little bit thicker, she can use a different setting for the eyes as well as the cheeks versus the chin and the nose. Now, one of the things that I do tell Stephanie that I personally like, because she will individualize the care and treatment plans for each patient depending on their concerns or areas that they have addressed with her during the consultation. So one of the things is I really like Stephanie go really deep on my nasolabial lines. Those are the lines that are right here in between my cheeks and my upper lips before my nose. And the reason being is because as we age, we lose the fat deposits on our face, which causes our face to kind of fall. Now, same thing when we're losing hormones. That can also make our skin more thin, more susceptible to fine lines and wrinkles. So the areas that I tell Stephanie that I really like her to take care of is my cheeks. Why, you say? Because I have hyperpigmentation, because I do love the sun, but also because with hormones, sometimes you can get that hyperpigmentation. Another thing is because I have such deep lines, I really like her to go deep right into those creases, because it's going to help my face recreate that collagen as well as the elastin to help hold it up. Okay, so one of the things that I forgot to make mention, and maybe that we didn't make mention when we were talking about one of the advantages of using microneedling, is it helps shrink those pores. Now, some people have pores that they're just uncomfortable with when it comes to pictures or looking in the mirror. Me, myself, personally, because we're in a climate that we have a lot of dirt and debris because it's so dry out here, is I love the microneedling because it helps shrink the pores and the visibility of it. So as you guys can see, my skin right now is changing. It's amazing and how it feels right now, because I can feel my body tightening that elasticity of my skin and how it's bringing it closer and more elevated. How would you like to explain that, Stephanie?
Yeah, so we are, like I said, we are injuring the skin purposefully. We want your skin to go through the healing process and turn over the skin to bring out the new skin that we're trying to make look more right. See, I can't when you throw me
So
in.
one of the great things about the microneedling system is it's going to have a high turnover for that collagen as well as the elastin. And because the skin cells turn over every 25 days, you're going to see those instant results right here, even after. So pay attention to how my skin is lifting during the procedure and how those pores are shrinking and how my skin looks nice and radiant. And that's what I love for patients, is for when they leave this office, their skin's going to feel tighter, more vibrant, as well as radiant.
We also want to remind people not to take any anti-inflammatories before or after your procedure. So if you do have a headache a couple days later, take a Tylenol, but no ibuprofen, Advil, or Motrin, because again, that's going to stop the natural healing process that your body is going through, and we want it to go through that.
That's a great point, Stephanie. All right, guys, so it's really exciting for me to share this with you, just because a lot of people go, well, you talk about these procedures, but do you have them done? All of them. So any procedure that, as well as service that we have an offer here at the clinic, yes, I have tried, as well as the staff has tried, so that patients can really know that we know what it feels like, what the process is to go through it, as well as the results. You can see it on our face. So the great thing about this, a lot of people will say, well, if you're opening up the pores as well as creating the microchannels, don't you worry about infection? Well, like I said, we take very good care of washing our hands before the procedure, using alcohol to clean off any of the bacteria from makeup as well as the regular skin. And we are using our own body's healing mechanisms to prevent infection, because platelets as well as that plasma has healing properties, so it's not going to cause an infection. Make sure you are taking care of your skin and following the post-treatment instructions.
Yeah, the risk of infection is very, very low. Just like Dr. Hammer said, we are using your own blood, so
you're not going to have a reaction.
You're not going to have a reaction to that. The cartridge here is a one-time use. We're not sterilizing it in any way. We throw it out.
We throw it out to the sharps container.
Yep. So it doesn't.
Each individual gets their own cartridge for their treatment. Okay, guys, see, my face after the procedure is nice and shiny, as well as you can see the redness that is after the actual procedure. My skin feels nice and tight. You can see how it's tightened up in my cheek area. My face is nice and smooth. I like to call it radiant and vibrant. But that's it. That's all it takes when it comes to the microneedling procedure. If you have any questions or concerns, please feel free to reach out to us at Vibrancy VIP Med Clinic. Give us a call so Stephanie can book you for a consultation, and we'll see you in the next video. Bye.
Bye.